Welcome to our presentation, Feel the Burn to Prevent the Burnout. The research investigators of this study were Trish Bond, Liberty Taylor, Lindsay Thompson, and Sherry White of King University. Learning objectives. By the end of this presentation, you will be able to identify the steps used to ensure this study was ethically implemented and the participants were protected, recognize signs of nursing burnout, discuss the importance of preventing nursing burnout, compare symptoms of nursing burnout before and after intervention. Learning objectives. Nursing burnout has been the subject of many studies. People are beginning to realize that this is a real problem. Nursing burnout contributes to job dissatisfaction, nurse retention, patient safety, and patient satisfaction. Some of the symptoms of nursing burnout are emotional exhaustion, depersonalization, feelings of incompetence, job dissatisfaction, anxiety, patient dissatisfaction with care, high risk of negative patient outcomes. There is a correlation between burnout and healthcare-associated infections, falls, medication errors, and other adverse events. So you can see why this is an important topic. Now that you know how important nursing burnout is and how it affects not just the nurse, but the patients and the facilities as well, you probably understand why we chose this topic. That brings us to the research question. Our research question was, among large university hospital acute care nurses who have experienced nursing burnout, how does following an exercise program for 6 months affect burnout symptoms? Now you know how important. Now let's look at why this is relevant and how it benefits nursing. Participant satisfaction with personal achievement and progression. The participants would have use of the Employee Fitness Center to potentially improve their health and personal well-being associated with increased exercise and possibly decrease the risks of nursing burnout. They may also see decreased nursing burnout symptoms. Going back to the symptoms we discussed, they may have increased feelings of competency, decreased emotional exhaustion, increased job satisfaction, decreased anxiety. You could see a lower risk of adverse events. In any hospital that's had to pay for a hospital-acquired infection or the injuries related to a fall would probably agree that's pretty relevant. You may also see increased patient satisfaction as a result of improved capacity for providing more compassionate care. Now let's look at why this is relevant. Ethical considerations are always important in any type of study. So the steps that we've taken to ensure ethical protection of the subjects are as followed. To ensure privacy, the participants would be assigned a number to use on their documents instead of providing their names. This includes their journals, interviews, and anything that's submitted, including the nursing burnout inventory. All the data would be stored and encrypted on a computer drive only accessed by the researchers. Ethical considerations are always important. The theoretical framework chosen for this study was Orum's self-care deficit theory. It was chosen because burnout occurs when nurses do not take care of themselves. The theory is appropriate for designing the program for nurses working towards taking care of themselves so that they can effectively care for patients. The following 7 slides are a summation of our literature review of 19 studies. These studies were focused on the prevalence and effects of nursing burnout and interventions for nursing burnout with a focus of physical activity as an intervention. Gaps in knowledge and recommendations for future research. More high-quality research is recommended utilizing larger sample sizes over longer periods of time with more seasoned nurse respondents and a measurable, defined evaluation tool. More research about work demands is needed. An experimental study is needed to determine causality, and health promotion studies are needed as well. Gaps in knowledge. Population and sample information. Our participants would be recruited from acute care nurses employed at Vanderbilt University Medical Center. We would seek male and female nurses ages 20 and older to volunteer to participate in the study. Population and sample information. Recruitment methods. All acute care nurses at Vanderbilt University Medical Center would receive an email requesting participation. 50 nurses who responded and completed the requirements would participate. Convenient sampling would be used since the participants will have to volunteer and identify themselves as willing to participate in the study. Recruitment methods. Data collection method. This is a mixed method, qualitative, interpretive, phenomenological inquiry that would be conducted over 180 days. The Maslach burnout inventory tool would be used at baseline in 6 months to evaluate nursing burnout. Structured interview sessions, baseline, midterm, and conclusion would be conducted, and participants would journal throughout. The Maslach Burnout Inventory assesses healthcare providers for burnout and the level of burnout if present. It does this by assessing 3 categories. A series of questions is asked in each category, and the response is one of the following: never, a few times a year, once a month or less, a few times a month, once a week, a few times a week, and every day. Each response is scored. The first category is emotional exhaustion. The Maslach Burnout Inventory. The second category is personal accomplishment. The third and final category is depersonalization. 3 recorded interviews will be conducted throughout the 6-month study. The baseline interview will be to discover thoughts prior to the exercise intervention. At 3 months, the interview will be to analyze the participants' feelings and progress. And the final interview at 6 months will be to determine if nursing burnout was affected by the phenomenons of exercise and journaling. The participants will keep a weekly journal where they specify the types of exercises they performed to determine if any specific type of exercise was more effective than another. Examples would be aerobic exercise versus strength training, flexibility, or balance. And also to see if the recorded negative feelings change to positive feelings associated with a particular type of exercise. The participants will keep. The population demographics will be separated by gender, age, in the increments of 10 years, acute care specialty, and the number of years of nursing experience to determine burnout rates among sexes, age groups, specialties, and years of experience. Division of these categories will also determine the effectiveness of exercise for burnout in each demographic as the study progresses. The population demographics. Data analysis methods. Qualitative content analysis. Interview sessions. Journals. Maslach burnout inventory. Thematic categorization. Physical symptoms, physiological and emotional symptoms, types of exercise, aerobic, strength, flexibility, balance. Demographics, gender, age, acute care specialty, and years of nursing experience. The study site will be Vanderbilt University Medical Center's Employee Fitness Center. Resources required. We would use the MBI to measure nursing burnout responses of the participants at baseline and at 6 months. We would provide participants with guided journal information and supply the journal for their weekly journaling. We would require permission forms from the hospital for the employees to use the fitness center and to monitor the badge readings in and out of the facility. We would require a conference area to discuss with the participants and obtain consents and conduct the interviews. And we would provide postage for the journals to be returned to the researchers. The proposed timeline. Total time would be approximately 1 year. Initial emails would be sent to the RNs regarding burnout symptoms, and the response time would be 30 days. Initial interviews would take 1 week. We would meet the participants and discuss the risks and obtain the consent. We would obtain the baseline MBI tool, which would take 1 week. The exercise program intervention would be conducted over 180 days. We're allowing 1 week for midline interviews, 1 week for conclusion interviews, 1 week for conclusion MBI tools to be returned, and then 3 months for data analysis. Class discussion questions. Do you feel that burnout is an issue in nursing today? Have you ever witnessed nursing burnout in a colleague or yourself? If so, how did you respond? Do you feel that exercise is a good option to help prevent burnout in acute care nurses? Please double-click the Word document icons if you would like to view the entire IRB form and the informed consent. Thank you for attending our presentation, and we hope you enjoyed the content. On this slide, you will find the references used for this presentation and proposed study.